with operation theater. Basically, what is an operation theater? Operation theater is also known as an operating. It is an operating room, and it is an operating suite or operation theater, which is a kind of facility within a hospital where surgical operations are carried out in a sterile environment. It is a kind of a room which is very sterile and it is used to conduct surgeries very very peacefully, and sterility is being maintained in there. That is called an operation theater. So, what are the objectives of planning? Means it is to promote the highest standards of asepsis or to ensure the maximum safety for the patients and staff from installation hazards, optimum utilization of OT and staff time, and smooth and effective functioning of operation theater, good working environment for doctors and the staff nurses, and it will allow the flexibility by use of multiple operation suits. So to meet the objective and the functions of OT, the planning consideration must meet these kind of criteria, which are as follows: like what what will be their location, its size, number of OTs, grouping of OTs, or zone. Then what are our equipments to be present inside the OT and installation. And for the technical staff, we need that OT staff, functional areas where the preparation of patients should be done, and then sterilization units or scrub stations, and designing and finishing. Then for the environmental factor, we need good lighting, air conditioning, ventilatory supply should be there, or proper ventilation should be there, fire safety, plumbing and clothing kind of environment we need for an to start an operation theater. Then ergometric or workflow. That means it we need like space for free movement of the staff, patient, and supplies so that it does not hinder the patient's propaganda. Or when the patients are when the staff is moving in and out, they should not bulge each other. Then in location, maximum 6 unit in one OT complex, preferably on the ground floor, should be there. Easy access to the CSSD, that is the sterilization unit, and emergency or surgical wards. Maximum protection should be there from the sun, sound, heat, and wind, and independent of general traffic flow. Means it should be the OT should be in a space in that space in which there will be no traffic or no sounds, no sun rays, and no heat will be there. Then it should be tracked. Then easy access to other OT areas. These OT areas should be, managed in such a way so that it should be very easy to access the other OT areas. The size of general OT, that is 18 into 80 or 40 square feet, and super specialist OT needs 60 square feet for the uh, operation theater. Additional room for heart lung surgeries or C-arm, etc. And paired OTs help in proper utilization of instrument and equipment. Then number of OTs. Number of OTs is equal to one OT of 50 for 50 surgical bed. We need one operation theater. All right. And the number of operation theater per suit should not exceed 6 per day or 8 to 10 hours per day. All right. See, there should be a protocol inside the OT as well that these many of surgeries can be done inside the surgery. Like if an 50-bedded OT is there, then 6 OTs can be done in a day, not more than that. All right. So, what are the factors which influence number of OTs? Like what kind of hospital is there? What type of surgery is there? Number of beds in the hospital? What is the hospital policy? What is the staff and strength of the capacity of sterile supply? Time for OT maintenance or turnover rate in OT? Average length of stay in OT? Then any kind of projected emergency surgical cases and average number of patients. Then zoning of OT based on the bacterial consideration and to provide maximum asepsis, the entire OT complex can be divided into two various zones. Like one is protective zone and one is clean zone. All right. So in protective zone, like disposable zone should be there and aseptic zone should be there. In physical facilities, reception of the patient should be there. Supportive services, administrative area, housekeeping, then storekeeping, repairing and maintenance, and clerical activity should be present inside the OT. So, what do you mean by cardiothoracic surgery? Cardiothoracic surgery, it is actually a field of medicine which involves the surgical treatment of the organs inside the thorax. All right, means the chest, or generally treatment of condition of the heart and the lung disease. Means in cardiothoracic, basically the heart and lungs are there, which in which the surgeries are done in cardiothoracic. In orthopedic surgery, the musculoskeletal surgeries or trauma, any kind of sport injury or degenerative diseases, infection, tumors, and congenital disorders is to be surgery is to be prepared. Then pediatric operation theater, and you have seen the operation theater, you have seen the recovery room as well, the intensive care unit you had seen. Then what are the operating protocols in the operation theater? So the protocols of OT includes the preparation of the patient, then preparation of the surgeon, hand washing, gown wearing, gloves, OT sterilization, and airflow rate. Then management of spills and body slashes. Then preparation of the patient. Hospitalization in 2 to 3 days prior to the surgery. Means if the patient needs the surgery, he has to get admitted before 2 to 3 days prior to the surgery. And a good bath to clean all the dirt from the body is to be done. Then outside clothing should be removed or discarded. And that's papa, na? सॉरी बेटा, थोड़ा कनेक्शन जो था वो लूज चला गया था, मेरे को फिर से लॉग इन करना पड़ेगा। Okay, so sorry for the interruption. Then we have to, we were like, we have to prepare the patient. जैसे मैंने आपको बताया, पेशेंट को प्रिपेयर करना होता है और 2 से 3 दिन पहले हमें सर्जरीज के बारे में बात करनी होती है। A good bath to clean all the dirt from the body part and outside clothing या तो आप डिस्कार्ड कर दीजिए या फिर हॉस्पिटल की जो क्लीन क्लोथिंग होती है उसको हम प्रोवाइड करेंगे। Then preparation of the surgeon you have to do then like showering and then OT dress up, cap, mask, eye protection and footwear for the preparation of the surgical site. Then how to prepare the surgical site? Like पर्पस क्या होता है सर्जिकल साइट को प्रिपेयर करने का? प्रिपेयर करने का मतलब उसको साफ करना। ठीक है, तो ये क्या करता है, to reduce the resident and transient microbial count at the surgical site immediately prior to making the surgical incision. हम इसलिए क्लीन करते हैं कि जब भी हमें कोई इंसिजन लगाना है सर्जिकल इंसिजन, तो उस टाइम पे अगर हम सर्जिकल साइट पे जो ब्लेड अगर लगाएंगे और वो अच्छे से डिसइंफेक्ट नहीं होगा तो सेप्सिस होने के ज्यादा चांसेस होते हैं। तो उसको पूरा क्लीन करना होता है। देन टू मिनिमाइज द रिबाउंड माइक्रोबियल ग्रोथ ड्यूरिंग द इंट्राऑपरेटिव एंड पोस्ट ऑपरेटिव प्रोसीजर एंड टू reduce the risk of post-surgical site infection. Then to prevent the injury to the patient during the surgical skin preparation. Then skin preparation हम कैसे करते हैं? Before the operation, wash the surgical site and the surrounding area with the soap, water. Particularly wash debris from the injury. If there is any kind of injury, then we have to wash the debris from the injury. All right. Then prepare skin with antiseptic solution and start its center and move to periphery. Then chlorhexidine, gluconate, and iodine preferable to alcohol as less irritant to the skin. And solution should remain wet on the skin for at least 2 minutes. जो सॉल्यूशन होता है वो एटलीस्ट 2 मिनट तक बिल्कुल वेट रहता है, तो उसे वैसे रहने दें, वैसे रहने दें जब तक वो सूखता नहीं। Then hand washing, we have to do hand washing. The single most important measure to prevent the infection is hand washing. So we have to wash our hand with the plain soap and water, and it is very effective for removal of the visible contaminants. And wash with vigorous mechanical section of all the hand surfaces for at least 40 seconds, and wash above the wrist and remove all the jewelry if you are wearing anything. Nail are the areas of greatest contamination, so it should be cut short. Then rinse under the pour water. Then hand washing, the steps of hand washing, what we have to do there, 11 steps of hand washing, and it lasts for 40 to 60 minutes. And hand rub is to be done for 20 to 30 seconds. All right. Then scrub for the scrubbing, what we have to do, remove the jewelry, use soap, brush, running water to clean the thoroughly around nails, scrub hands and arms up to the elbows. After scrubbing, hold your arms to allow the water to drip off the elbow. All right, and turn off the tap with the elbow. Don't touch it with the hand. Then, in scrubbing, after scrubbing the hand, dry with the sterile towel to make sure that towel does not become contaminated, and hold the hands of the forearm away from the body to the higher elbows and until putting a sterile gown or glove. आपने हाथ बिल्कुल सीधा रखने हैं, हैंड हाथ ऊपर की तरफ खड़े रखने हैं ताकि कंटेमिनेशन हो जब तक आप गाउन नहीं पहन लेते। नाउ हाउ द गाउनिंग इज टू बी डन? Place the arms to the sleeve and have a non-scrub assistant pull down over the shoulder so that uh, it should hand go to the sleeves. I think हमने फर्स्ट ईयर में भी गाउनिंग और ग्लविंग देखी है कि गाउनिंग हम कैसे करते हैं एंड ग्लविंग कैसे करते हैं। Then gowning, after the gowning and gloving, we have to go for draping the patient. And draping the patient, what is its purpose? The purpose is to isolate the surgical area from the other parts of body that have not been prepared for surgery. Then isolate from non-sterile operating room and equipment and personnel. A double layer drape is effective, and 2, 3, 4 drapes can be placed over the endotracheal tube. For isolation of the mouth, clear the plastic drape with the adhesive side. All right. Then plastic patient's head is to be placed on the sterile sheet covered by the 2 towels, and towels are used to drape the patient head actually, and then additional towels needs to be added if added to the isolate the surgical area. All right. Then we have to clean the then we have to clear the drape sheet, and it is placed with the adhesive surface before contacting to the skin just above or below the mouth. with effective isolate from the surgical site. Right. Then during the closure of the operation, we have to confirm the completion of the surgical plan. Then we have to report the anesthetic regarding the completion of the procedure, and then check for the satisfactory wound closure and cessation of the hemorrhage. If there is any kind of bleeding, we have to check, or any kind of hemorrhage is there, we have to check for that. Then mouth should be checked for float, debris, swabs, extracted teeth, and make a count on them. Mean make a count on the गॉस पीसेस में might be हो सकता है कि गॉस पीसेस जो हो वो आपके किसी जो पेशेंट की सर्जरी हुई है वहाँ पे तो हमें जो स्क्रब नर्स है उसका एक काम होता है कि उस टाइम पे वो सारे के सारे जो भी गॉस पीसेस होते हैं गॉस पैटर तो उसको काउंट करके आपने रखने होते हैं और काउंट करके सर्जरी के बाद उसको बाहर रखने होते हैं कई बार अंदर भी छूट जाता है अगर आपके 5 काउंट्स हैं और 5 काउंट से 4 ही आ रहे हैं आपके द सर्जरी इट मीन 1 इज इनसाइड द पेशेंट बॉडी तो वो आपको आप अथॉरिटी होती है कि आप उसको ओपन करा सकते हैं एंड बाद में उससे वापस आप उसको निकाल सकते हैं ठीक है देन द क्लोज ऑफ द ऑपरेशन दैट इज थ्रोट पैक रिमूवल राइट द ऑपरेटिव नोट्स ऑलराइट then keep the patient in recovery room and in recovery position emergency situations can be managed by surgeon anesthetist and both all right so this was our operation theater की operation theater में हम क्या क्या करते हैं then we will go for infection control में हम we'll see about the what is infection control and what do you mean by sterilization antiseptic disinfectant principles क्या होते हैं ठीक है वेंटिलेशन एयर चेंज क्या होता है प्लानिंग कंसिडरेशन क्या क्या होती हैं इसके अंदर स्टैंडर्ड यूनिवर्सल प्रिकॉशंस क्या होते हैं ठीक है तो इसके बारे में हम कल पढ़ेंगे और टुडे वी आर